If your pharmacy shelf have any bottles of Atorvastatin, pause for a second because this week over 140,000 bottles of generic Atorvastatin were officially recalled due to a quality failure that could impact patients' outcome. I'll walk you through the recall details, affected national drug codes, and most importantly, what pharmacists should do right now to protect patients. Hi, I am Mayank, licensed pharmacist with RX Indian Pharmacist channel, your go-to guide to pharmacy knowledge. Let's understand this breaking news spreading across US. According to US FDA, Aurobindo Pharma USA has initiated a voluntary recall of over 140,000 bottles of Atorvastatin calcium tablets, one of the most widely prescribed cholesterol-lowering medications in the country. The recall involves multiple strengths, 10 mg, 20 mg, 40 mg, and 80 mg tablets sold under the generic labels. What's the reason? The reason is failed dissolution specifications during stability testing. The tablet not release Atorvastatin properly, potentially reducing drug absorption and therapeutic effect. The affected lots were distributed nationwide through wholesalers, mail order pharmacies, and retail chains. Why this recall matters? Let's pause for a second and understand about Atorvastatin. Atorvastatin is a top 5 prescribed medication in the US. Millions of Americans rely on it daily to manage low density level cholesterol and reduce risk of heart attack and stroke. So a recall like this isn't just a logistic issue, it's a public health priority. If patients continue taking affected lots that underperform, their cholesterol, their low density level could rebound, potentially increasing cardiovascular risk over time. And that's where pharmacist vigilance becomes critical. Now let's understand the key recall details. The FDA lists specific lot numbers under national drug codes that includes Aurobindo Pharma USA Incorporations, Atorvastatin calcium tablets. Following are the NDCs that are getting displayed on the screen, so you could identify if your shelf has NDCs mentioned on this screen in your shelf. You should get alert. Lots distributed between November 2023 and July 2024 or with expiration dates 2026 are affected. You can verify affected lots by searching the FDA Recall Market Withdrawals and Safety Alerts section. If you are working in pharmacy chain, hospital, or mail order pharmacy, check for those NDCs immediately. Most wholesalers have already pushed recall notifications, but manual double checking is the safest move. What pharmacists must do? Let's understand that. Number 1, check and quarantine. Pull all bottles matching affected NDCs or lot codes. Label them do not dispense. Recall pending. Follow your internal recall SOP, whether that's through McKesson, Amerisource Virgin, or Cardinal. Number 2, notify prescribers and patients. If any patients recently received medication affected with that lots, reach out proactively. Reassure this is not a contamination issue but a potency or quality issue. Advise them to continue therapy with a replacement lot to prevent LDL rebound. Number 3, document everything. Record all recall actions, as in lot numbers, quantities, communication logs for compliance with state board and FDA record keeping standards. Number 4, educate staff. Ensure technicians and interns understand the difference between potency failure versus contamination recalls. This builds public trust and reduces misinformation at the counter. How to counsel patients? Here is a quick counseling checklist for patients affected by this recall. Don't stop Atorvastatin abruptly without physician advice. Bring back any bottles matching the affected lot. Pharmacies will replace them for you. Continue to monitor cholesterol and adherence as advised. If using mail order pharmacy, check your refill label for manufacturer's name, often printed near NDC. Let's understand pharmacist takeaway. As pharmacists, we are the final checkpoint between a recall notice and patient safety. This is one of those times when recall vigilance meets operational precision. because when a recall affects a drug as common as atorvastatin, how quickly we act determines how patients stay protected. So friends, stay alert, stay informed. If you haven't already subscribed to my channel, subscribe to my channel RX Indian Pharmacist, and if you like this information, give it a thumbs up. So see you next week in another video like this. Until then, bye for now.